HIV, woman beats HIV using novel treatment. A woman from New York appears to have been cured of HIV after undergoing a risky treatment. Doctors say they can't discover any trace of the virus in her system after she finished her therapy a year ago. The woman, solely identified as the New York patient, was diagnosed with HIV in 2013 and was diagnosed with leukemia in 2017. Her predicament appeared dismal, but it also made her an ideal candidate for rare and dangerous stem cell treatment. The surgery is only administered to HIV patients who also have late-stage cancer that requires immediate intervention due to its high fatality rate. Doctors must get umbilical cord blood and bone marrow from a donor who has a particular mutation that makes them immune to the virus in order to provide the treatment. Only 1% of the population, primarily Northern Europeans, have this condition. The umbilical cord blood and bone marrow are then utilized in a procedure known as haploidentical cord transplantation, which tries to treat the patient for both HIV and cancer. The cord blood aids in the battle against blood malignancies, while the bone marrow supplies the body with stem cells, enhancing the treatment's efficiency. The risky surgery was performed on the patient in issue 4 years ago at the New York Presbyterian Weill Cornell Medical Center. Her body had responded nicely to the intervention, according to doctors, and positive findings were reported shortly after. The patient's cancer had gone into remission, and she had been able to stop taking her HIV medication last year. The woman has been checked several times since then, with no symptoms of the virus resurfacing. Clinicians have also extracted cells from her and attempted to infect them with HIV in a lab setting, but have been unsuccessful. The New York patient is currently the first female and fourth individual to be cured of the illness. 2 females are reported to have naturally overcome the illness. Doctors, on the other hand, are not in a haste to declare victory. You don't want to overcall it, UCLA's David Geffen School of Medicine's Dr. Yvonne J. Bryson said. Remission, she believes, would be a better word to use to describe the woman's current state. Before doctors can formally declare the New York patient cured, a few more years must pass. Dr. Bryson stated the stem cell treatment's outcome has given the researchers greater optimism and more possibilities for the future, adding that it has given them more hope and more options. Dr. Koen van Beseen, director of the stem cell transplant program, stated about 50 individuals per year in the United States could benefit from the surgery. Thanks for watching.